Hi, my name is Emily Haynes, and this is my head-to-toe assessment project. The person I decided to assess is actually my husband, who was nice enough to let me do a full head-to-toe on him. I pretended like I've never met him before, because I already know a lot about him, but so first I started out just by talking to him, saying hi, kind of trying to make sure his speech was normal and that he seemed alert and oriented, which he did. He knew the date, time, place, year, all that stuff, so he was alert and oriented. So basically I just started at the head, visualized his hair, which was normal, thick and no dryness or falling out or anything, and then kind of looked at his face. The features were all symmetric and proportional to his head and his body, and so everything there looked pretty normal. Next I examined his eyes, which didn't have any drainage or redness or anything. He did report that he wears contact lenses all times, and that he mentioned that he had pretty bad vision, and I did see the lenses in his eyes. His pupils were normally and reactive, equally reactive to accommodation and light, and they were a normal size, and his eye movement had good, I'm trying to do it in the camera here, but his eyeballs had good movement, and everything seemed fine there. Looked or visualized the inside of his ears and nose, which were normal, no buildup of wax, no anything visually wrong. The skin on his face was normal, no dryness, no redness. Mucous membranes in his mouth were pink and moist, and no ulcerations or dryness or thrush in the mouth, any weird colorations or anything. His teeth were normal. Noticed some fillings in them, which he had had previously. And auscultation of the throat area was normal, red, moist, everything looked good. And then moving down to the neck and shoulders and arms, which I did next, everything was normal. The skin was intact, no dryness, redness, anything like that. His hands and fingers were intact. He did have a large cut on his right index finger, which he reported was from a few days ago at work. It was bandaged. I opened it up. It didn't look infected. It was about 1 inch long, not very deep, no blood from it, so that was okay. His fingernails were trimmed, short, looked good. His capillary refill at his nail beds was about 2 seconds, so that's normal. His grip was strong, both hands equally good and strong, and then his radial pulses were also strong bilaterally and equal. And then I checked his range of motion. He did some arm movements for me. All the range of motion seemed normal. So I moved on to the thoracic abdominal area. Inspection was normal. Skin looked good, intact all around. So next I auscultated his heart, lungs, bowel sounds. Started with his heart sounds, which were normal, strong. Heart rate was about 64. Lung sounds were clear and equal from the front and the back, and sounded really good. And then his bowel sounds were normal to hyperactive in all 4 quadrants. He reported that his last bowel movement was today, and that he's pretty regular daily with those. Then I moved on to palpation of his abdomen. Could kind of feel his liver. Everything felt normal, soft, non-tender, no pain. So everything felt good there. And then I asked him, I didn't visually assess genitourinary organs, but he reported no issues with that. I did ask him about like testicular self-exams for males. They're supposed to do a monthly. He said that sometimes he does. And side note, as his wife, I do have him check. Okay, anyway, back to my assessment. And so then I moved down to his lower extremities, and the skin looked good there. The first thing I noticed were some calluses on his knees, which he reported he has a manual labor job, so he spends time on his knees, which can be kind of rough on them. I also then noticed a swollen area under his right kneecap that felt like fluid. I could press it down about 1 inch, and it didn't cause him any pain, kind of had defined borders. So I asked him about it, and he stated that he sometimes will get swollen when he has a particularly hard day at work, and that he's down on his knees a lot. He stated that he was a painter, and they've been doing a really large job, so he's been working a little extra, so it was swollen. He said he's had it checked out by a doctor, and everything was fine, and he reported that it usually went away within a couple days when that did happen. So I noted that, but there was no other swelling, no edema in his legs. The skin was intact, no ulcers or anything. The popliteal pulses were good behind his knees, equal and strong. And then I did feel his pedal pulses as well, which were strong, moving down into his foot area. His toenails were trimmed and intact, but it did look like he had an ingrown toenail on his left big toe. It was kind of red, a little bit swollen, and he said usually those go away in a few days. He gets them every once in a while, so he didn't report any real issues with that. I did test his range of motion of his lower extremities as well, which was normal, and he has full purposeful movement, and no other issues as far as the lower extremities. Overall, I feel like most of my assessment findings were normal, and then again I was checking skin throughout the whole assessment, and neurological status through the whole assessment. Now, I knew him, so I kind of knew his baseline, but if it was a patient that I didn't know, I would probably have asked more questions as far as health status and normals, just because since I do kind of know his baselines. But overall, I found my assessment to be pretty normal. There were a couple abnormal findings, but nothing that really affected him functionally or physically. So that is my assessment. Thank you very much.